Hello, this is Elizabeth EK, HSC 250, reading case study number 2, beginning with 2-1, title Displaced Fracture of the Femoral Neck. While walking home from the train station, M.A., a 72-year-old woman with osteoporosis, tripped over a broken curb and fell. In the emergency department, she was assessed for severe pain, swelling, and bruising of her left thigh. A radiograph showed a displaced left femoral neck fracture. M.A. was prepared for surgery and given a preoperative injection of an analgesic to relieve her pain. Intraoperatively, she was given spinal anesthesia and positioned on an operating table with her left hip elevated on a small pillow. Intravenous antibiotics were given before the incision. Her left hip in abduction, blood and fluid replacement, physical therapy, and vigilance for development of avascular necrosis and possible dislocation. Case study 2-2, titled Intertrochanteric Fracture. A.R. age 88 slipped on the wet grass and fell while gardening in his backyard. His neighbor was unable to help him to a standing position and called the ambulance. A.R. had excruciating pain in his right leg, which was externally rotated, slightly shorter than his left leg, and adducted. Preoperative radiographs showed a non-displaced right intertrochanteric fracture. Intraoperatively, Mr. R was given spinal anesthesia and positioned on an orthopedic table with his right hip abducted and secured in traction. He had an open reduction and internal fixation with a compression screw and side plates with screws. His postoperative recovery was unremarkable, although he was at risk for deep vein thrombosis, which is blood clots in his legs. He was discharged to a rehabilitation facility for several weeks of physical therapy and assistance with activities of daily living, such as personal hygiene, dressing, eating, ambulating, and toileting. Case study questions. Write a word from the case histories that means the same as each of the following. Number 1. Replacement of half of the joint's component is reduction. Number 2. Substances that act against microorganisms are antibiotics. Number 3. In a position away from the midline of the body is abduction. Number 4. Position toward the midline of the body is adduction. Identify and define the prefixes in the following words. Number 5. Displace and dislocate. Prefix is dis, meaning out of, apart, or away. Number 6. Replacement and rehabilitation. Prefix is re, meaning back or again. Number 7. Avascular. Prefix is a, meaning lack of or without. Number 8. Anesthesia and analgesic. Prefix is an, meaning lack of or without. Number 9. Orthopedic. Prefix is ortho, meaning straight or to correct. Externally, prefix is ex, meaning outward. Bipolar, prefix is bi, meaning to. Unremarkable, prefix is un, meaning not. Thank you.